My name is Kate Halligan. I just got an order from Dr. Who for the patient Linda Bletcher for Coumadin 5 milligrams PO daily for atrial fibrillation. It is for today and time stamped for now. I'm just going to go double check that order in the MAR, make sure that it's correct. I'm going to get the Coumadin. 5 milligrams, expiration is 03/20/40, so we're good on that. I'm going to go introduce myself to my patient, make sure she knows what's going on, and then I'm going to come back and get the medication for her. Hi, Miss Linda. How are you doing today? Good. Just going to pull a curtain for privacy. So I heard that you came in and you experienced some atrial fibrillation. Have you ever heard of that before? Or have you ever been diagnosed with that? No? Okay. I'm just going to check and see what your heart's beating. Okay. So the medication that you were prescribed was from Dr. Who. It's called Coumadin. It's going to help with your atrial fibrillation, which is your heart is beating at an abnormal rate and a rhythm, and that's because your upper two chambers aren't working properly. So this medication is going to help, and Coumadin is great for not letting blood clots occur. And when you do have atrial fibrillation, that is one of the major side effects of that. Could you verify your name and date of birth for me? Okay. No known allergies? Okay. So some of the side effects of this medication is going to be bleeding or bruising. So if we do a lab draw on you, which we will do in a couple hours, you might get a little extra bruising on your arm or wherever they stick you, just because this medication can make you bleed a little bit more, so you do need to make sure you are doing okay on that. Are you on any other blood thinners? No? Okay, good. And do you have any allergies? No? Okay. Alright, so do you have any difficulty swallowing? No? Okay. I'm just going to help reposition you really quickly. Will you just take a sip of water for me? Okay, how did that go? Okay, good. Do you have any questions? No? Okay, I'm going to go get that medication for you and I'll be right back, okay? Here's your cola and your water, and I will be back in a minute, okay? Okay, so I'm going back into the MAR. I'm pulling my medication. I'm going to go back into my patient's room. Alright, so, you doing okay? Alright, can you verify your name and date of birth one more time? Okay, good. And no known allergies? No, okay. Alright, I'm going to get logged into the computer. I'm going to scan the wristband, scan the medication. Okay, here's the medication for you. And here's some water. I'm just going to document that went okay. Did that go down okay? Okay. Do you have any questions or concerns right now? No? Okay. I'm going to come back in and check on you in about 30 minutes, okay? Alright, don't hesitate to call. Here's your cola and your water, and someone will be back to check on you, okay? Alright, thank you. My patient, Julia Child, came into the emergency room today with a burn to the hand. Dr. Who has prescribed 1 glass of Ample IM for today and timestamp for now. I'm going to go talk to my patient's mom really quickly, make sure that's okay, good course of treatment, and then I'll be back to grab that medication. Before I do so, I just want to verify that med. I'm going to go into the MAR, make sure that it's correct. Yep, 1 glass. Okay. Alright. gonna go check on my patient. Hi, Miss Julia. Oh, are you in pain? Yeah? Okay. Just gonna sit towards my hands, pull the curtain. Alright, hon, so I see that you got a little burn to your hand over here. Okay, so we're going to give you a shot that's going to help relieve that and get that healing properly, okay? All right, Mom, do you have any questions about this? The doctor has prescribed a shot just to help with the burn to the hand, make sure it doesn't get any worse, no infection or anything, okay? What's that, sweetie? Yeah, the shot's going to hurt just for a couple seconds. And then I'll put a Band-Aid on it, and then your mom will get you some ice cream or something special, okay? Okay. Does she have any allergies? No? Okay. Julia, can you tell me your first and last name and your date of birth? Okay. Mom, is that correct? Okay, good. And no allergies? Okay. Well, I will be right back. I'm going to go grab that medication, and then we'll get this over with, okay? Alright, here's your call it your water. I'll be back in a couple minutes. Okay, so I'm going to go back into the Pyxis. I'm going to grab my medication. Get an alcohol swab. And a pair of gloves and a Band-Aid. Alright. You know what? First, I'm going to break open the ampule and I'm gonna tap it, make sure it's good, break all it off, use an alcohol swab. Then I'm going to pull back. We need 1 ml. Okay. I'm going to put the cap back on. I'm going to go into my patient's room. I'm going to bring that so that I can scan it in there. Alright, honey. So this is only going to hurt for a second, okay? Just sanitize my hands one more time. Mom, can you verify her name and date of birth? Okay, good. I'm going to log into the computer. I'm going to scan her wristband, scan the medication. Okay, so I was thinking we do this side because that side is where the owie is, okay? Alright, do you want to sit in Mom's lap? Okay. Mom, why don't you get her in your lap? Great. Okay. So I'm going to sanitize it. Sanitize. I'm going to go 3 down, 90 degrees. Oh, good job. All done. Alright, and then here's the Band-Aid. I put the Band-Aid on it. And then this is going into the sharps container. Alright, hon. You okay? Okay. I'm going to document that I gave that to her. Put everything in the sharps. Alright, I'll be back to check on you in a little bit, okay? Alright, do you have any questions right now? Mom, anything? Okay, we'll be back in 30 minutes just to check on her to see how her pain's doing and seeing if the swelling and the redness is going away, okay? Alright, hon, Good job. All right. I'll check on you in a little bit.